Hi, so continuing with our basic definitions and mechanism of labor, today we'll be discussing the fetal skull. Now, the fetal skull is made of the cranium, and the cranium is the least compressible and the largest part of the fetus. So, the cranium is made of two frontal bones, two parietal bones here, two temporal bones, and an occipital bone. And dividing these bones are sutures. So we have the frontal suture which divides the two frontal bones. We have the coronal suture separating the frontal bones from the parietal bones. We have the sagittal suture separating the two parietal bones, and we have the lambdoid suture separating the occipital bone from the parietal bones. Now the sutures are important because they help in molding, and they also help us determine the position of the fetus when we examine the patient. We also have an anterior fontanelle, which is a diamond shaped meeting point of the frontal suture, the coronal suture and the sagittal suture, and it ossifies at 18 months of age. And we have the posterior fontanelle, which is triangular in shape and is the meeting point of the sagittal suture and the lambdoid sutures. The anterior fontanelle is also called the bregma. Also important to know is we have the occiput behind, the sinciput in front, and we have the vertex here, which is formed by the anterior fontanelle in front, the posterior fontanelle behind, and the parietal bones on the side.